In this buzz of Madison County, we're sharing part of a very frank and informative conversation about something that just could save your life or a loved one. And we're not talking about COVID-19. This entire month, by the way, is dedicated to making sure that you know about this topic. And now it's my pleasure to welcome today's guest to The Buzz, Dr. Jennifer Fisher. Dr. Fisher, if you would, please share a bit about yourself.
My name is Jennifer Fisher. Previously, my name was Jennifer Zook, so some people might know me as that. I've been in the community hospital system in Anderson for going on about 8 years now. I did my radiation oncology training at Indiana University. I completed a 5-year residency there, and then I stayed at IU for a couple of years after I completed my residency, and then got an opportunity up here in Anderson, and I've been here ever since, and I love it here.
What drew you to this particular field of practice?
So, good question. I actually found out about radiation oncology because I actually was working for a year prior to going to medical school. And when I graduated college, I didn't know that I wanted to do medicine. I thought I was going to be a researcher. And then I kind of switched gears because I did research for a summer, thought that's not for me. And so I said, okay, I'm gonna try it. I'm gonna go, into medical school. And I had all the kind of courses that you already needed, but I needed to take a special entrance exam called the MCAT. And so I really needed to study for that year. So I took off a year and I wanted to work in the healthcare field. So I went to undergrad at Goshen College in Goshen, Indiana. And they had just opened up a cancer center across the street from the college. And so I applied for a job, and the job that they had was the receptionist position at the radiation oncology department. So that's what I did for a year. As I worked in the radiation oncology department, I was the front desk person, so I kind of greeted everybody, checked everybody in, and then I became kind of a member of the team. And so I loved how interactive the field was. I liked that you got to see patients and develop a relationship with them, sometimes over a period of 8-9 weeks, where they come daily for the radiation. So that was kind of how I fell in love with it, and I liked the technology piece of the field because we're always improving our machines and the ability to spare normal tissues and make the treatment less toxic for people. So that's been really interesting over the years to see how that's evolved. But that was something that drew me in as well. So yeah, lots of reasons why I love it.
That kind of lends itself to my next question. You mentioned the technological advances. Are we gaining any ground conquering cancer?
Yes, I believe we are. I just the other day saw a news piece about length of survival for lung cancer patients and how, that's improving over the last few years. And shockingly, we are seeing people that normally we would have given a 6-month life expectancy. We're seeing them live years. Mostly that's with the advent of immunotherapy, which is a type of treatment that can be used for cancer when it's spread to other places. And lung cancer is one of the biggest areas that we use it for, but we use it for skin cancer, for example. In people that have a non-curable type of skin cancer, they can go on this immunotherapy and maybe even be kind of in remission for the rest of their life. So there's lots of things that we're seeing. I think we're definitely making advances in the treatment of cancer.
Do you find that a lot of people initially downplay the symptoms, whether it be something visible or something internal?
Yes, I do. I do see a lot of people, kind of blowing off a symptom, saying, oh, I just thought that was normal, or I just thought I was getting older and so I was getting some pain somewhere. But I always encourage people, if there's something that doesn't seem right or it seems like it's progressively getting worse, more frequent, lasts a longer time, seek medical attention. Make sure you tell your primary doctor about it and see if anything additional needs to be done.
Here we are in the month of May. What are we observing this month in relationship to cancer?
The month of May is generally Skin Cancer Awareness Month, and we like to draw attention to the fact that skin cancer is the most common cancer that people can develop, and 1 in 5 Americans will develop skin cancer in their lifetime. There are a number of different skin cancers. The majority that we normally think about are melanoma, squamous cell carcinoma, and basal cell carcinoma. Those are the 3 most common types, but skin cancer in general is the most common cancer we see.
Are there people who are more predispositioned to contracting cancer?
Yes, people are at risk depending on their skin tone. So lighter skin individuals have a higher risk for developing skin cancer. Sun exposure as a child or even growing up, sunburns before you're an adult, all of those predispose you to a higher risk of developing skin cancer. Even later in life, sun exposure without using sunscreen, all of that does make a difference. And tanning beds. Tanning beds used to be really popular when I was young, and I went to the tanning bed multiple times. I regret that now on many different levels, but that's a big thing that I really try to make sure that people know that definitely increases skin cancer risk as well, going to the tanning bed.
I've also read that some medications can increase your risk.
Yes, that is true. So there are some immunosuppressant medications. For example, if somebody has a kidney transplant and they have to take drugs to kind of suppress the immune system from attacking the kidney that was transplanted, then they're at increased risk for developing cancer. And basically that's because these medications that you take basically, decrease your immune response. And normally when you're in the sun, if you get a sunburn or even a suntan, the reason your skin tone changes is because there's damage that's happening. And so your body has to repair that damage when it heals a sunburn. And so in that repair process, that's where things can go wrong. And not everybody has repair mechanisms intact to, repair the damage to their skin. And that's when skin cancer can start to grow, as there's one abnormal cell that doesn't get repaired and then it starts to overgrow. So people that have immunosuppression are much more likely to develop skin cancers. Other examples are rheumatologic conditions, so people that have rheumatoid arthritis or, other things that require them to be on these immunosuppressant drugs.
What can we do to help protect ourselves from that?
The biggest thing is to, when you're out in the sun, avoid midday, anywhere from about 10 to 2 or when the sun's rays are at their highest potential for damage. I really encourage sunscreen wearing 30 SPF or above. There's lots of different sunscreens on the market nowadays. There's chemical sunscreens, there's physical sunscreens. They work in a little bit of a different way, but there's lots of different options for people. There's also lots of clothing that they make now that's SPF 50 or higher. So, just covering your head if you're going to be mowing the lawn and you're losing some of your hair on top, and you don't want that exposed. You want your cap on. You want to try to kind of wear clothes that protect your skin, try to be under shade. So those are the biggest things, is just by preventing exposure is really the best way that you can prevent skin cancer.
What are some of the red flags that should alert us that it's time to go check into this?
Yes, so anything that's new and seems to be getting worse. So something can have been there for a while and then all of a sudden it kind of changes in color. So anything that you see that's getting really dark, changing from kind of a brown color to a black color. Anything from something that goes from perfectly round to an irregular border. So something that kind of looks asymmetric. Anything that bleeds or is painful or itchy. Those are all things to get checked out. And, anything that's different that you just don't know what it is, you should probably be asking somebody, is this normal? There are, precancerous skin conditions that can sometimes appear to be cancer, but we really have to biopsy them in order to know. So it's really important to bring that to your doctor's attention or even visit a dermatologist to do screenings. Some dermatologists do have, or most dermatologists do have programs where they put people into a screening, yearly. So you just go once a year and you kind of get your screen, and those are really for people that are high risk. So the lighter skin individuals, people that have already had previous, small skin cancers that have been treated. There's lots of people that get screenings on a regular basis. So I just encourage you, anything that's different, bring it up to your doctor.
Once upon a time, and we touched on this a little bit earlier, when you heard the word cancer, a lot of people were scared that it was a death sentence. That doesn't necessarily hold true now, as you alluded to earlier, and even more so with skin cancer. It's not a reason to fear the worst.
Absolutely. Melanoma is the most dangerous of the skin cancers, and like I was talking about previously, immunotherapy is something that we are using. I myself don't prescribe that medication, but my colleagues who are medical oncologists, they're the ones who administer that. So there's lots of treatments now for melanoma that did not exist previously, but melanoma is the most dangerous, highest potential to spread elsewhere. Basal cell and squamous cell carcinomas, they're much more locally destructive, so they'll kind of grow in an area and they kind of tend to disrupt the area surrounding wherever it's growing. So it can infiltrate into other areas like bone, but generally those don't spread like melanoma does to other areas.
You just talked about the procedure that you don't prescribe, but some of your colleagues do. Can you describe that?
So immunotherapy, which I was talking about for melanoma a lot of times, and even now in squamous cell carcinomas, we have immunotherapy that can be given for people that have kind of diffuse cancerous, multiple skin cancers that just can't be treated because there's so many of them. They're now available for treatment with this immunotherapy. And basically what immunotherapy does is it's an IV, so it's a medicine that goes in through the vein and goes throughout the body and basically enhances your own immune system to attack the cancer cells. So typically we don't see side effects, like we do with chemotherapy as much with immunotherapy. Immunotherapy does have its own set of side effects, but in general is much better tolerated than chemotherapy. So I always encourage people, to not say they're not going to do something because, I tell them just to try it because a lot of people nowadays can really go through treatment without a lot of difficulty. And we've got great medicines to treat about any side effect that you have. So immunotherapy is definitely something that is on the forefront for treatment of skin cancers.
And should I be diagnosed with one of these forms of skin cancer, what is the most likely treatment that I would see?
Sure. So when we first see somebody, usually they are already diagnosed with cancer. So prior to coming to us, the first step is really getting referred to a dermatologist for evaluation of an abnormal skin lesion. So I really recommend that if something is going on, you notify your primary care physician who can then get you into the hands of a dermatologist. They would biopsy the lesion and determine whether or not it was a type of cancer. That's where they would determine if it's a basal cell, a squamous cell, or a melanoma. Sometimes just by looking at them, they have characteristic features, but really you need the biopsy back before you can make a determination on what type of cancer it is. Depending on what size it is, generally surgery is really the mainstay of treatment. So normally either a general surgeon or a surgeon that does cancer surgery specifically for skin will do the surgery. And there are some cases where patients might not opt for surgery given the location of the skin cancer. For example, if somebody had a skin cancer on their nose or their ear and they didn't want a disfiguring surgery because generally they would have to remove significant amount of tissue that they would have to cover it with a flap or some other type of tissue. So in those situations where it might be disfiguring for a surgery, sometimes we can just do radiation as the primary treatment. And both the squamous cells and basal cells respond great to radiation as a primary treatment. Melanomas are definitely more resistant. So with melanomas, usually surgery is really considered to be necessary for melanomas. So, but in the other forms of cancers, I treat those routinely.
Any parting thoughts before we close today?
Well, everything that I said is really important. It's important to spread the word. Talk to your neighbors, talk to your friends and family. If they have something, that's going on, urge them to seek medical attention. I also want to make sure that people know when they're out and about this summer in the sun to really, protect themselves. Use either sunscreen or some of the other methods like the, covering of the skin or wearing a hat or just not, being in direct sunlight for that period of time. So really it's protecting yourself and letting somebody know if something's going on.
Dr. Jennifer Fisher, oncologist with Community Health Cancer Center in Anderson. Thanks for your valuable time and information and for doing your part to make our community a better place to live. Share this with someone you care about. May is Skin Cancer Awareness Month. Thanks for listening. That's the latest buzz of Madison County.